Well, you just heard from Bill English. We won't be hearing once again from Jonathan Coleman, but we are being joined now by the Southern DHB Commissioner, Kathy Grant, who has been listening to all of that on the phone. Kathy Grant, thank you so much for joining us. You were a ministerial appointment back in August 2015 after the Health Minister sacked the DHB board. That's right, isn't it?
Yes, that is correct, John.
Right. What do you say to Bill English's recommendation that you need to make arrangements for those patients to get surgery as soon as possible?
I think that I would prefer to take that conversation one step back, John. And as you are aware from your telephone discussion last evening on Checkpoint with the Chief Executive, the review that has been the subject of much comment has been initiated. It will be with us next week, as I understand it, and I will be looking to the Chief Executive to bring to me plans for implementation in order that we can plan pathways forward for patients.
Right. In terms of the patients themselves, who probably aren't interested in pathways and more interested in surgery, what is it you recommend they do?
I am not in a position to comment on individual cases. I would, of course, I'm most concerned about our patients. The delays that have been described are indeed very regrettable. We need to identify the actions that can be taken and to address the issues that
the actions that can be taken surely are for the hospital to do what a hospital exists to do, and that's operate.
That is correct.
I'm just a bit confused about all of this. You are now pinning your hopes on a review that the hospital really had to be forced by their own surgeons into undertaking. You have two full-time equivalent...
If I may correct that statement, the preparation of and the undertaking of the report was as much initiated by the DHB as by the urologist.
Okay.
It was in both of our interests to understand what the issues were in the delivery of that particular service.
Aren't the issues really simple? And there are some discussions around inefficiencies, but the issues are simply that you have two full-time equivalent urologists, right? Nelson has 4, Palmerston North has 4. Why does Dunedin have 2?
Well, that is a clinical issue that, as Commissioner, I am not in a...
It's not a clinical issue, is it? It's a financial issue.
Well, I'm not... you would need to have a conversation, or you would... it would be more helpful if you were to have a conversation in relation to that matter with our Chief Medical Officer. But
we've spoken to your Chief Medical Officer. Look, I'm so sorry to interrupt, but we keep talking to people who shimmy around the buck. We've spoken to your Chief Medical Officer, who admitted that things in some respects, particularly around ICU bed numbers, aren't as he would have them. We've spoken to your CEO, who is very forthcoming and comes on when we ask him, and he has said he is not satisfied with waiting times, and he is not satisfied with what's going on in the urology department, and he is not satisfied with ICU bed numbers. We keep hearing this. Now, I look at your appointment by the Minister in June 2015. You were appointed to address a deficit. You were given financial KPIs. In July 2015, your employers asked to pay you more money because of the very unpopular decisions you might have to pay. And people keep telling me they don't have enough money to do what they need to do. Now, the buck for that stops with you, doesn't it?
Absolutely. And I have articulated that our challenge is to make the Southern District Health Board sustainable and reposition it in such a way as it is sustainable.
Financially sustainable? What about financially?
If I might finish,
surely.
Sustainability is a measure across, in my view, 4 dimensions: financial, clinical, quality, and our workforce. If we focus only on any one of those, we will have failed. It would have been when the Commissioner team was appointed in June 2015. The deficit could have been eliminated by a slash and burn exercise. That was not a pathway that we chose. It's a question of repositioning Southern in such a way as to be a sustainable organisation. So the driver is not simply a financial one.
If we look at some of the targets that the ministry has, for example, after formal diagnosis of cancer, meaningful treatment within 31 days, the longest kind of calendar month. If Paul Schofield has now been waiting for over 4 months and has absolutely no idea still when his cancer is going to be treated, is that satisfactory, do you think?
No, it isn't. It isn't satisfactory. The comment that I would make is that Southern has suffered from really years of underinvestment and significant deficits. So the pathway forward is going to take a period of time. There is no
which is look, absolutely, which is all very well and good when we're talking about financial KPIs and deficits and budgets and bringing things in under what the government requires of you. But if you have prostate cancer and you are waiting for treatment and you don't know when it's coming, do you think that you want to even hear those discussions taking place?
Probably not. I acknowledge that the delays are regrettable, that the patient groups that you have been talking to do need their surgery. We are making progress. We are investing in the future of Southern DHB and initiating change.
That is Cathy Grant, who is the Southern DHB Commissioner. We really appreciate you joining us this evening, Cathy Grant. So we have had the hat-trick from the South. We have had the Commissioner, we have had the CEO, and we have had the Chief Medical Officer. All that is left is the Minister, Jonathan Coleman, who consistently says no to our invitations to him appearing on Checkpoint. This does increasingly look like a financial consideration. The buck for that surely stops with the Minister, and we do invite him once again to join us whenever he can.